And the plague in America just keeps growing and growing and growing. The opioid plague ripple effects, hepatitis C spreading in Georgia. And this came out November 16th, 2017, and I will leave the link to this article in the description box. Georgia's opioid plague isn't just destroying families and local economies, it's also spreading other diseases. For the first time in history, Georgia's level of hepatitis C infection has surpassed 14,000 victims in 1 year. Woo, that's a lot of people. Okay. And they are saying pretty much that the main culprit seems to be people sharing heroin needles with each other, which is causing the hepatitis C outbreak in the state of Georgia. Health officials can't interview every patient whose case is reported, but among those are the most common risk is the hepatitis C victim, also reporting intravenous drug use. More than 70% report having done it at some time in the past, and more than 60% report having done it within the past 6 months. It led us to believe that the ongoing heroin and opioid plagues are related to hepatitis C as well, which I definitely agree. I agree with that. So right now, this is only complicating things when they're sharing needles. And, it also shows you the reason why, because they're considering it a public health issue. They have to make sure, if they're going to go that route, they got to make sure these junkies out here have clean needles. And obviously, it's not being done enough if you see 14,000 victims with hepatitis C in 1 year. Okay, let's get back into the article. State Representative Sharon Cooper, the committee chairwoman, pressed on the issue of treatment, which she noted was wildly expensive compared with most Georgian household incomes at a cost of approaching $20,000 or more. So that's for treatment, and that's probably per person. That's very expensive. When we say referring to treatment, Cooper said, it would seem that for many people and drug users, that would be a big, huge barrier. The committee also heard from an expert in needle exchange programs and discussed ways to destigmatize treatment for infectious diseases in order to persuade more victims to get treated. The House Study Committee on Georgians' barriers to access to adequate health care has now finished meeting and is tasked by many law with considering whether to recommend legislation. Over the course of its meeting, it has discussed infectious diseases such as the flu, asthma, and HIV, as well as the opioid plague and mental health services. Any recommendations are to be issued by December 1st. Well, I thought y'all had high IQs and know everything, so you need to see what other people recommend in order for you to piggyback off of somebody else's idea. But, we have high IQs, right? State Rep Betty Price, a committee member, also attended this week. In the previous meeting, she made nationwide headlines by asking whether HIV patients could legally be quarantined, comments which she said were taken out of context. Following Thursday meeting, she commented on the need to work towards providing more Georgians health care, and she added that at the moment she didn't think she had anything else to say. The Senate has a similar committee that has focused on different barriers and will have its own recommendations. Okay, so in other words, they don't know what to do. Just like they don't know what to do with this entire drug plague that has hit the country. Now you got to deal with, I know in San Diego, they're dealing with hepatitis A. There's also hepatitis B outbreaks in many rural areas. You got hepatitis C because they're sharing needles. HIV is on the rise. STDs are up because a lot of these junkies are having sex for drugs. I mean, everything is exploding right now. You know, I'm just saying, and maybe y'all need to take your leadership in a whole different direction. Obviously, the people that are leading are just not the right ones to lead. If you were, we would see changes, but we are not seeing any changes in any of the major things that are going on in the country. And you know what, ladies and gentlemen? We won't. Please leave your comment and subscribe. And if you can, remember to hit on that notification bell. Peace, family.